Hello friends. So today I have a very special guest with me and meet Anupama and I have a very special connection with Anupama. I'm actually meeting her after probably 10 years.
Yeah.
Alright. Yeah. So I'm meeting her after 10 years. The special connection that I am talking about is that she is actually the first patient whom I have treated back in 2010. So that is my first patient in private practice, let me put it that way, because before that I was training in orthopedic oncology, and then I was working at an institution, government institution as a professor. But when I started my private practice, Anupama was the first patient who actually put faith in me and my work and got ready to get operated by a young surgeon at that time. So she had a tumor in the upper end of tibia, that is the bone below the knee joint. She had a tumor in that joint, which is known as Giant Cell Tumor. Now, as we all know, Giant Cell Tumor is not a cancer, it's a benign tumor, but it was just underneath her knee joint, and actually she had got an advice or an opinion or a suggestion from a doctor that she should undergo a knee replacement surgery. That means that you should take out this much of bone and put in a special type of a prosthesis. Now, at that time she was only 30 years old, maybe less than 30 years old.
Yeah,
around 30, 35 years old. And if you can understand it, at 30, if you are undergoing such a big joint replacement surgery, what consequences we probably have to face. So I actually suggested her that no, we can take out the tumor from inside the joint, inside the bone, and we can probably save your joint. And I am so glad that we were successful in doing so, because at that time I did the surgery, removed the tumor, packed that cavity with some bone grafts, and here she is in front of us. This is 2025, so it's been precisely 15 years, because I operated her in the first week of April, and today is 6th of April 2025. I operated her in the first week of 2010 April. So it's a real coincidence that she has decided to meet me today, and it's been exactly 15 years. I'm so glad that she is doing so well, and maybe we'll hear something from her now, but too much from me. So Anupama, I want to ask you what were you going through at that time in 2010 when you were suggested this surgery and all those things?
Actually, my world was like it halted, because at that age when my both kids were so young, and listening itself to the term knee replacement was a big blow for me and my family. But then it happened that we met Dr. Mandip. So after that we came to know that there is a surgery. He can perform that surgery, and without any knee replacement. And that surgery was very well done by him and Dr. Kalpesh. And now I am here after 15 years. I am perfect, and I am able to do all the things which everybody does. And I think I was more active than before. I am more confident actually. And I am happy that I have gone through this surgery by Dr. Mandip, and it's really a dream for me that I'm sitting before him today, acknowledging his work and the confidence Dr. Mandip has given to us before the surgery, and even after surgery. The way he used to take care of us was really appreciable. And in the meantime also, he used to suggest us what we have to take care and how we have to go through all the things. And all those things really worked for me, and now I'm here doing all the things, and I used to go for the trekking also.
Yeah, so you just told me that she's a very religious person, so she actually had a dream of going to a temple parikrama in Tamil Nadu, and I think she has recently shared with our viewers.
Actually, 3 years before, we are from South, and there is a temple Tiruvannamalai in Tamil Nadu. the thing is we have to do a parikrama of 14 kilometers. Which is a dream for me. I used to think that will I be able to do that, but just 3 years before I have done it in a very reasonable time, and like everybody used to take some maybe 5 hours, I have taken just 7 hours.
I would probably take more than that.
So that dream has come true, and even I can do all the other things like climbing stairs and all is nothing. That's all thanks to Dr. Mandip.
No, there is nothing. We as doctors can perform our duty very well. Honestly, that is what we can do as doctors. But her husband, Mr. Suresh, he is also working for a car industry.
Yeah.
And maybe we'll ask him also what was going through his mind when these things were coming up.
Frankly, that time when we listened about it, my entire thing has got shattered. So I decided anything I can do to make her, to stand on her feet and move forward. But when we heard that without knee replacement it can happen, I was really, given a lot of blessing from my bottom of my heart. I'm really thankful to Dr. Mandip and even Dr. Kalpesh along with him performed an excellent surgery. And even the team has done a brilliant job. And many thanks to Dr. Kalpesh and Dr. Mandip. And we keep remembering and showering all our blessings all the time.
That is what matters. But I would want to ask you one very personal question.
Yeah.
What made you think that a young surgeon can do a good job? Now I think in retrospect you are learning that you are my first patient. So suppose today you knew that this is a very young surgeon. He has probably never done a prior practice, and I am going to be his first patient. It's difficult to put a faith in someone because a senior guy or a very experienced people have suggested to go for joint replacement. When a young surgeon is saying, no, you can save the joint. So what was that, which make you put faith in me? Okay, I can. This man, though he is very young, can do the job.
Maybe there comes the sixth sense or the interaction between us which has made us confident that you can do it, and also the advice, I would say, of Dr. Kalpesh, which has made us think that it will be you who will be doing that. So, and see today that confidence has worked as a miracle for us.
Yeah. Beyond all that, Almighty who has blessed with that.
So now, I have just told her that she doesn't need to come to me as a patient, but she can certainly keep visiting me as a friend. And I would wish to see her once in a while, just to say, when she can drop in and say hello to us. And more than that, they have invited me for a dinner.
Yes.
At their house, so I promised them that I'll be there at their home for the dinner where she's going to make good South Indian food for me.
Yeah, sure. And also I'm going to gift a nice Tanjore painting.
Yes, so she's a good painter, and so that promise she has to keep, and I keep my promise of visiting her at her home for the dinner.
Yeah.
So thank you, Anupama. Thank you, Mr. Suresh.
Yeah, thank you so much
for interacting with us. I think this will inspire a lot of people.
Definitely.
And, this kind of interaction I keep posting on social media just to reinforce the fact that, when you are with a specialist who exclusively treats those kind of entities, problems, the results can be sometimes miraculously, positively better.
Yes.
Right?
Only the suggestion I would like to give to your patients is please have confidence on Dr. Mandip. He is a gem.
Well, thank you so much. Thank you very much.
Bye.
All right. Thank you for interacting with us.
Thank you.